Well, welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. Our special guest today is Corey Jo Biddle, the Executive Director of Fuel Milwaukee, a community engagement organization that focuses on young professionals. So Dr. Raymond, let's start out the week with an update from you.
Okay, thanks, Tim, and good afternoon, everyone. This first slide summarizes the various indicators of COVID-19 that we've been tracking, and I'll run through these quickly. The doubling time for COVID-19 was slightly improved to 15 days in Wisconsin and 18.9 days in Milwaukee. The daily growth rates over the last 7 days have been stable at 3.4% in Wisconsin and 2.9% in Milwaukee. And there were 199 new positive tests in Wisconsin today, down to the lowest number this month. There were 70 new positive tests in Milwaukee and only 27 new cases in Brown County, also down significantly. There were 6.5% positive tests in Wisconsin and 12.5% in Milwaukee. And recall that these last two are Badger bounce back gating criteria. The COVID-19 diagnostic testing capacity has been stable at about 13,800 for the last week. Intensive care unit beds and ventilator capacity remains stable and is adequate. Personal protective equipment trends are also improving to stable in both Wisconsin and Milwaukee, with the most urgent critical shortage being of gowns. Next slide, please. This next slide, I think, highlights some very important news. The Milwaukee Expanded Testing Initiative, which is led by a partnership of city officials, health system partners, and our federally qualified health centers. Now, this is connected to statewide goals, but locally we hope to expand to 2,000 tests per day in Milwaukee County, and there are 2 sites that open with a capacity of 500 each today. The whole idea is to provide equitable access to testing and to connect tested patients to follow-up clinical care and various social supports. We also want to ensure timely collection of demographic information, including age, gender, race, and address. Now, the results will be publicly reported and monitored. Next slide, please. Just wanted to highlight the 2 new locations, and these were open today. I heard earlier that there were lines of cars at both sites. One is at Midtown Center on Capitol Drive, and the other is at the United Migrant Opportunity Services on Chase Avenue. Now, these testing sites are open to the public from 8 a.m. to 8 p.m. daily. You can walk up or drive up, and they have a capacity right now of about 500 tests per day per site. And I want to emphasize that anyone can get tested. There's no appointment needed, no cost, and you really don't have to have symptoms. I also want to highlight that in addition to these special testing events, testing still continues to be available through community health centers, long-term testing locations that you've already grown accustomed to, and that individuals without a connection to a federally qualified health system, a community health center, or to a physician or other primary care provider can call 211 to find testing locations nearest to you. And with that, I'll turn it back over to Tim.
Sure, Dr. Raymond. As we bring Corey Jo in here for the discussion, just want to ask you one question on the testing to start. And as you've acknowledged in these, we're getting close to 14,000 tests, and that was a goal, but we're only administering a couple thousand across the state. In order to kind of ramp up the testing, because it seems like we have capacity there, where would you start in terms of prioritizing who gets tested and where they get tested?
Great question. I think I would prioritize 2 places, and I think the tests that just rolled out today deal with one of those issues, which is where the disparities are in terms of the impact of COVID-19. So the near northwest side and the near south side of Milwaukee would be the predominantly African-American and Latino neighborhoods that have been disproportionately affected by COVID-19. So I would definitely want to focus there. And then I would like to partner with the business community to help do proactive testing in segments of the economy that we want to open up pilot studies, so to speak.
Thank you. Corey Joe, thanks for joining us this afternoon. And you've been doing a set of webinars on your own, reaching out to a broad group of young professionals and others in the community. So the first question for you is, what's the biggest concern or the biggest two concerns you're hearing from the audience that you're engaging?
If actually, there's probably the top three, and I'll quickly share them. Sure. Our biggest webinars with the largest attendance have been around mental health, mental and holistic health. So people are really concerned about, how do they deal with the anxiety and depression and other effects that come from uncertainty and the changes that have come from being in quarantine for so long. The other two are really around going back into the workplace. So folks are really concerned about their personal safety. And as you mentioned, 80% of our members are young professionals. So these are the 20 and 30 somethings who generationally, love communal workplaces, will share desks, want to be in shared workspaces. Now they're finding themselves concerned with, their personal safety, if they can touch surfaces, if they're touching elevators, if that's going to be safe and what that is going to look like in the new normal. The third thing is also related to work in that a lot of our members are leaders or burgeoning leaders that have sort of been fast-tracked into these positions and have never experienced anything like this before. The oldest millennials are around 40. The oldest Gen Zers are right around 22, 23 years old. So they've never experienced or seen anything like this. I mean, none of us have, but to be in a leadership position and leading teams, folks are really concerned about what that looks like when you're leading folks and you're uncertain, and how to communicate that with their teams. I don't know what's next, but still instilling that confidence that we'll get through this, we'll figure it out, and everything will be fine.
Well, tell them not to worry, because even crusty old people like me haven't experienced this before. So the second question I have for you, and I'm kind of surprised it didn't come up in the top three, is, we've got, as 500,000 people in Wisconsin that have filed for unemployment comp. That's 15 times more than last year. Are you starting to hear, are you hearing concerns about their job and whether it's going to be there when they come back, and kind of the impact on the economy?
Tim, it's funny because we've done webinars on all of the topics that I'm talking about, including providing financial and career resources for people or earners who have been affected by this in any way. So whether they've been furloughed, laid off, their hours have been shortened, or they are kind of anticipating that they might be laid off. Lots of people came to that webinar, but they're not as vocal about that concern. I don't know if people are just afraid to talk about it, but there's a lot of anxiety around what is going to happen and what are our financial securities. And bear in mind, the I generation, this is the combined, millennials and Gen Zers, have more student loan debt than any generation before them. So they're kind of, carrying the weight of that now, with the fear that they won't have any financial means to dig themselves out of debt.
What do you think that we talk about this, and the way forward is making sure that employers instill confidence in their employees, that the workplaces are safe, and then of course for the economy to come back, if 2/3 of it is consumer spending, the consumer needs to be confident. So what can employers do to instill confidence for young professionals, and then what kind of confidence are they building as consumers?
I think what's come up over and over again in our webinars, even with the speakers and the questions we've been getting, is folks want transparency. They just want to know what's going on. So even if the news is going to be bad news or maybe something that they don't want to hear, people really kind of want to see that the path that's being laid, if every brick's not down, that's fine. They just want to know that there's a road to the way back or the new normal. I think it's the same thing on the consumer end. I mean, folks are definitely going to hold on to their dollars a little bit more. We're seeing that with our membership. We've even started, it's going to start on Thursday, our own Smart Money Matters portion of our webinars that are kind of going to financial literacy in the middle of a crisis, because folks are asking for that. So it's not that they want to stop spending completely or that they don't want to participate in stimulating the economy. I think they just want to make sure that they're doing the right things with the resources they have, and that they're allocating it in a new way based on what's going on in our world today.
Yeah, one of the great things about fuel is the diversity that you have in your fuel membership and your fuel group. Are you seeing different reactions across the diversity that you have in your audience?
We are. So about 80% of our members are in that 40 and under category, and about 30% of our members are people of color. So there's a divide, obviously, in the community based on what people's experience has been with the Safer at Home. So very early on, our first webinar was really about, you know, debunking the myths around COVID-19 and young professionals and people of color, because those are the things that kept coming up. Lots of folks that are people of color have not had the opportunity to stay at home because a lot of their roles have been essential workers. So for instance, my brother lives with me. I'm safer at home, but he has to leave every day. And with that, you know, people of color are 4 times more likely to die of COVID-19 if the, you know, all of the studies and research that we're reading is correct. And there's an anxiety that comes with that. Folks are concerned about what that's going to look like as they're processing in their anxiety, and their counterparts of white descent or other descents might not necessarily understand that. You know, they're dealing with everything that we're going through and losing people. My aunt lost 4 people. You know, I just can't fathom what that feels like for her. I haven't had that happen to me personally, but there's a little bit of a divide because people's experiences are so different, and we're not able to connect as we normally would and talk about what that means for different pockets of our community.
So you touched on this kind of in your opening comment, but give us a sense of what people are looking for going forward, and the reaction to young professionals who are not relatively new to the workforce. What do they think is going to be a permanent change going forward? And, you know, what do they see as positive, and what do they see as the biggest challenge?
Yeah, we've asked them, what do they think, what have they learned about themselves as professionals, as people, and what do they hope to see going forward? And I think loud and clear, we've heard that the lines between personal and professional are more blurred than ever. And one of the good things about that has been that folks have been able to connect on deeper levels. People that have been working together for years are much closer now because of this shared experience, and because of the way we have to communicate, we can see into each other's homes. We know what people's pets look like. We know what people's children look like. And I think that is one positive that folks hope continues. I think there is an anticipation, though, that the normal will be new, and that the way that we've worked in the past probably won't be the same, at least until there's a vaccine, and maybe indefinitely.
Yeah. Let's bring Dr. Raymond back in. And Chris, questions for Dr. Raymond and Corey Joe.
Yeah, Corey Joe, I guess I'd start out by asking whether there's been a reaction in the community of underrepresented people to the new testing sites, and whether people see this as helpful at all.
Yes, people do see it as helpful. I mean, there was a huge source of frustration for people, and now that those doors are open, people can definitely make sure that they're safe, especially since so many people are having to go out of their homes every day for work. And the fact that there aren't very stringent constraints around testing and how you can be tested and who can be tested, I think that's a very positive sign, and folks are really responding well to that.
Question for Tim and Dr. Raymond about the governor's decision to quote unquote turn the dial today. Some people are asking us if we're moving too quickly. Other people are asking whether there's any basis to letting 5 people in one store and unlimited numbers of people into other kinds of stores that were already open.
I'll let Dr. Raymond start with a kind of health professional answer, and then I'll talk about it from a business perspective.
Yeah, I don't think it's too early to turn the dial a little bit and see what happens. As we've said several times in the last week, we sort of reached an equilibrium with COVID-19, and actually some of the trends even look like they're improving a little bit. So this would be the time for us to turn the dial and carefully see what happens.
Yeah, and I respect the governor for taking this step. I think it's an appropriate next step, but it also shows very much the blunt tool that the state has in Safer at Home. And when you make an announcement like this, which is wonderful news for small retailers, but they're not prepared today to open up. Some of them are going to have to figure out how to call their employees back, build their supply chain. So the challenge is, it's great to be open, but now I got to figure out how to get back open. And I don't want people showing up to my business tomorrow and I'm closed and they're wondering why I'm closed. So again, this just shows you the difficult nature of the tools that we have to deal with this wicked problem.
Dr. Raymond, we had a couple of questions about the new open testing sites. One, to clarify, this is to detect current infections and not antibodies, right?
That's correct.
Another question is, if you don't have any symptoms, is there a reason to go get tested right now? And connected to that, and I think we know the answer to this, if you test negative today, does that mean you could still be positive tomorrow?
Yeah, let me start with the first one. Yes, if you test negative today, you could test positive tomorrow. It really depends on where you are in the course of your infection. And the test isn't perfect. It does have some false negative rates early on. So that's important to know. If you're asymptomatic and have not been symptomatic at all, I would say there's no compelling reason to get a test. But if there's capacity and you're curious and want to know, I think that's okay. We don't know enough about the prevalence of the disease in our community. I would like to see us using all the testing capacity that we have.
Right. Another question was from somebody in the business community asking about the best practices for temperature screenings, or in lieu of not having that technology available, is there some sort of questionnaire that they could be asking their employees every day to sort of detect these symptoms?
Yeah, really good question. Most of us know that temperature screens aren't all that good, and it's difficult to get the no-touch thermometers right now. So another screening instrument where people take their own temperature or they address their symptoms is one of the strategies people have been using.
One more question about the use of ventilators, which perhaps hasn't been as widespread as was predicted early on. What alternatives have kind of emerged since we first saw COVID come to our shores here?
Yeah, that's really an excellent question. We have not had to use our ventilator capacity, even our non-surge capacity. I would say there are two reasons for that. The first is we're learning a lot about ventilators in COVID-19 and doing things to keep people off of ventilators. So that would be one. And the second is we flattened the curve here. If we had not implemented safer at home and social distancing, I feel strongly that we would have overwhelmed the capacity of our intensive care units and our ventilators.
Corey, Joe, got a quick question for you too. As you look at, again, the young professionals that you're talking about here, a lot of them have kids who are now, of course, not in school, may not have that opportunity for summer school and camp. So anxiety there at all in terms of, again, coming back to work in a more unsettled situation than they might have been going to work in the past?
Yeah, I think there's a hope because of the shared experience that there will be more flexibility. Again, nobody knows, but I think we're all sort of in the same boat and just anticipating that employers are going to address this on a case-by-case basis to the extent that they can.
Great, thanks to you all, and thanks for everybody who asked a question today.
Good. Well, thank you for starting us out, Dr. Raymond, this week with an update and a good dialogue on testing. Corey, Joe, thank you very much for joining us and sharing the perspective that you brought. Very interesting. And tomorrow, again, we'll get an update, and then we're going to talk about the role of public health in determining our steps going forward, and maybe looking back at how public health played a critical role in forming the policies that we're all dealing with. So have a safe and healthy afternoon. And again, thank you for joining us.
Thanks, Tim. Thanks, Corey, Joe.
Thank you.